All right, and welcome back for another edition of our Vet Project, highlighting some of the top important stories or just topics that will help you keep your pets safe and healthy. Joining us today, Dr. Levi Embry with the Embry Veterinary Clinic. We're talking kidney stones today.
Yes, indeed.
I did not know that critters
Yeah.
could get kidney stones. I mean, it makes sense. I mean, we all have the same kind of tracks and systems and everything else, but for those who don't know, what even is a kidney stone?
Yeah, kidney stone. So there is, broadly, there is a group called uroliths, and uroliths is basically just a stone in the urinary tract, either upper or lower. Specifically, a kidney stone is a nephrolith, which is a stone in the kidney or in the ureter. The ureter is the tract that runs from the kidney to the bladder. So if it's in that area, we call it a nephrolith. If it's in the bladder, we tend to call it just a urolith. They're really just concretions of minerals.
So like solidified.
Correct.
I know a lot
Yep.
of people call them crystals. Is there a difference between urinary crystals and urinary stones? What's the difference there?
There is a crystal. The easiest way to think about it is a crystal is going to be a whole lot smaller,
Okay.
and it's not always the same, not always caused by the same thing. So, but yeah, so a stone you can think of as being just bigger.
Okay, so
Yeah.
just size-wise, not like there's more pain versus one versus the other.
No, and usually a crystal is going to be almost usually, not always, but usually a crystal is going to be secondary to infection in like the
Okay.
bladder, for example. Whereas the most common nephrolith, the most common kidney stone, is a calcium oxalate, and there can be calcium oxalate crystals, but calcium oxalates are probably the most common kidney stone.
I'm glad you brought up the word common because that was my next question.
Mm-hmm.
How common is this among dogs, cats?
Yeah, not
Birds?
super. I don't know. I don't think bears get them.
Okay,
Yeah,
good.
I
I
don't know. That's
don't
outside
know
my
either.
wheelhouse. But but dogs and cats, not very common. So amongst uroliths, meaning stones in the bladder or stones in the kidney or in the ureter, or anywhere in the urinary tract, kidney stones make up about 1 out of 50. So much more common is a bladder stone.
Okay. Much more common is a bladder stone. Okay. So what causes this to happen? What causes these masses to form?
Yeah, the most common one, it depends a little bit on what type of stone, but the most
Okay.
common one is the calcium oxalate, so I'll probably talk mostly about that one. The calcium oxalate stone is caused usually by a excess of calcium excretion through the kidneys.
Okay.
And so in a lot of cases, you can see a calcium oxalate stone with diseases that cause high calcium. So things like hyperparathyroidism, which is a hormonal disease that can cause too much, a mismatch in the calcium and phosphorus, among other things. You can see it when you have a hypercalcemia of malignancy that's associated with cancer.
Okay.
And you can see it with probably Cushing's disease, which is also known as hyperadrenocorticism, too much cortisol. Those are probably the three diseases you'll see a calcium oxalate stone with most commonly. There are some genetic abnormalities that you can see that can cause a calcium oxalate stone as well. You see in some breeds, most commonly in the bully breeds, like the Old English Bulldog, or even the Pitties or Rottweilers. You can see in those.
Really? Okay. Interesting. Because, in my head, I'm thinking maybe I'm getting it wrong, but not having enough water as a way of getting it. But I could be getting this mixed up with UTIs because someone who
Yeah.
doesn't know, it all kind of blends together at some point.
Yeah, well, sufficient hydration is good to cause sufficient perfusion through the kidneys, through the bladder, and that can help. That can probably help reduce the likelihood, but
Okay.
usually it's caused by something kind of apart from that.
Have you had moments where you're going in to treat this issue, the kidney stone, and finding out that there's other problems like hypothyroidism or cancer that's not found that wasn't known before?
Sometimes you can do that. Yeah, sometimes that does happen. Yes,
Okay.
where it presents it, but usually you're not. Usually you're going in to treat a bladder issue or a urinary issue of some kind, and then you may find the stone, and then you may find the underlying disease like Cushing's disease. Or
So
something
almost like a
that.
domino effect, starting
Right.
off with
Yeah.
my animal is having a tough time going to the restroom or
Right.
there's pain. How long does it take for this to become a dangerous situation for the animal?
Can take a while.
Okay.
In fact, a lot of kidney stones can be clinically silent for years. But they can serve as what we call a nidus of infection. So it is something to be aware of, and it's ideally they won't be there. But they can be. Sometimes you can see a dog, an otherwise healthy dog that has or apparently healthy dog with no clinical symptoms that has a kidney stone. Yep, that does happen.
And it's just sitting there kind of gaining
And
size
that,
until it
exactly.
becomes a problem.
Right.
There's blockage or whatever.
Yep.
So, okay. All right. So, is it dangerous if the other kidneys is working overtime to kind of
Yeah.
compensate?
That's a good question because and that can be one of the things that makes kidney stones kind of hard to find sometimes, or
Yeah.
hard to pick up on, because whenever we're evaluating kidney health, we rely on a couple things pretty heavily. One of them is the presence of azotemia in the blood work. So azotemia is an increase in two values on a chemistry panel, BUN and creatinine. Those will go up in kidney failure, but they will only go up after we have about 70% loss of function. The other thing we can look at is urine-specific gravity. So that is a marker of how well the kidneys are concentrating urine. That goes up only when we lose about 60 to 65% of kidney function. So in both of those cases, if you have one kidney, if you lose one kidney, you still have the other one functioning. If it's functioning at 100%, you still have 50% function, right? And so that's enough to definitely keep the azotemia at bay, and possibly not and keep the urine-specific gravity to sufficiently high that you may not notice that either.
I know
within the normal range.
we brought this up for for a slight moment, but what are some of the symptoms that we can anticipate, and how are they different between like cats and maybe dogs?
Okay. Well, in cats and dogs, usually if you're going to notice anything, you're going to notice the first thing you'll notice is probably what seems like a bladder problem, right?
Okay.
Infection or hematuria, which is red blood cells in the urine.
So is that like blood?
Yes,
Okay.
correct. And that's probably the first thing you'll notice in both of those. If you do reach the point, if you pass that point without reaching it and you hit kidney failure, a lot of those animals are just going to be clinically sick. They're going to be maybe inappetent. They're going to be lethargic. They're going to be dehydrated.
Okay.
And just seem like they're not doing good.
So sluggish, visual signs of pain, something's
Yeah.
wrong. There's blood in the urine, something's up.
Yeah, if you get to that point where they're lethargic and all that, they're probably pretty far along.
Can it be deadly?
Yeah, so if it causes obstruction, especially if it's bilateral, if it causes bilateral obstruction of the kidneys, those animals will go downhill very, very quickly.
Oh, goodness. So what does treatment look like? Because I'm sure, like with anything else, finding it early on, the treatment is probably easier and quicker and takes effect. But like you mentioned earlier, some of these signs can show up really late, or you find it very late.
Yeah, treatment historically has always been surgery.
Okay.
So you can cut into the kidney, you can cut into the renal pelvis, and pull those out. There are newer treatment modalities that incorporate lasers or extracorporeal shock wave, it's called, where they try to break the stone up and then basically flesh it out. That is something, especially the extracorporeal shock wave and the laser and all that, that's something that is not, that technology and that skill set isn't going to be present in most veterinary clinics. That's going to be something that probably a specialist would do.
And a vet would most likely advise
Send
you.
send them to a referral center. Yeah.
Okay. Have you had to do that before?
So I've never sent anybody to a referral center over that. The unfortunate thing is a lot of times whenever you see a kidney stone, not always, but oftentimes whenever you see a kidney stone, because it's often secondary to something like hypercalcemia of malignancy, those animals are very, very sick, right? And so, not always, but often. And so, combined with the fact that it is relatively rare in comparison to like a bladder stone, I don't recall ever having sent a dog or cat for kidney stone removal.
Do you have an experience that kind of sticks out when dealing with this kind of situation, maybe before with a pet?
Yeah, so one specific case stands out in mind where the kidney stone was probably not the first sign, but one of the things that kind of led us down the path saying this animal probably has cancer.
Oh gosh. Okay. So, what are some of the things that we as pet parents can do ahead of time to try and help? 'Cause like you mentioned, a lot of these things may be hereditary, maybe
Hmm.
something that they're already dealing with.
Hmm.
But what can we do as maybe a peace of mind, knowing that we're helping our animal prevent this from happening?
Yeah. Again, I wouldn't. If I was going to say one thing about that, I would say don't worry too much. Worry less about the kidney stone and more like about about bladder stone. Again,
Okay.
the proportions are about 50 to 1, right? So 50 for every one dog that has a kidney stone, there's about 50 out there that get a bladder stone,
Okay.
right? So that's the biggest issue, which is actually good because it's much easier to go into a bladder and pull a stone out than it is to go into a kidney and pull a stone out.
There's various
Right?
sizes, different
Yeah,
entryways.
yeah, different. Basically, anytime you cut into a kidney, you're risking damaging the kidney, right? And so there's a lot more potential complications associated with a nephrotomy, which is where you cut into a kidney, than there is with a cystotomy, where you cut into a urinary bladder.
Oh wow. Okay. A lot of things to take in, a lot of things to consider. Is there anything else you want us to know before we kind of wrap things up here?
No, I would say, one other thing. Yeah, one other thing actually. Early detection is good. So if you do think, again, the most common thing you'll see is straining to urinate, maybe blood in the urine.
Okay.
Go get that checked out. Chances are it's not a kidney stone, but if it's a bladder stone, you want to get that taken care of. If it's just an infection, hopefully you can get that taken care of before it might turn into a bladder stone. Right?
Better safe than sorry.
Yeah, that's right.
And
So
no one
early
wants to see
detection is
their
key.
animal in pets or
That's
their
right.
pets in pain or
Right, right.
anything. Okay, well, Dr. Levi, we appreciate you coming in.
Yeah.
Levi
Always a
Embry with
pleasure.
the Embry Veterinary Clinic. We appreciate you having
Yeah.
me on.